You've heard it a million times, right? Broccoli is this incredible superfood, a cancer-fighting machine. And it all comes down to this one little compound, sulforaphane. But here's the big question. Is that all just hype, or is there real science to back it up? Well, that's exactly what we're going to dig into.
I mean, it's such a compelling idea, isn't it? Just eat your broccoli and you can fight off cancer. And we're going to dive right into the research to see what's what. But before we go any further, there's something really important we have to get out of the way.
Look, the goal here is to arm you with information, to help you understand the science so you can have smarter, more informed conversations with your actual doctor. This is absolutely not medical advice, and it should never ever replace a conversation with your oncologist. Okay? Okay.
All right, so here's our game plan. First, we're going to tackle a hype head-on. Then we'll get into this huge, and I mean huge, absorption problem. From there, we'll look at what the actual evidence points to, touch on its impressive anti-inflammatory abilities, and then wrap it all up by figuring out where the real power is.
Okay, let's kick things off with the hype. I mean, why is everyone so obsessed with broccoli? Why is it always on the top of those superfood lists? Well, it pretty much comes down to one single tiny molecule.
And that molecule is sulforaphane. This is the stuff you find in all those cruciferous veggies. You know, broccoli, kale, cauliflower. It's really the hero of our story today. Researchers have been fascinated by it for years. But, and this is a big but, getting it from the plant and actually into our bodies where it can do some good, yeah, that's where the story gets a little tricky.
And that leads us straight into our second section, what I'm calling the big absorption problem. You know, it's easy for something to look amazing in a lab, in a little petri dish. But getting it to work inside the complex system that is the human body, that is a whole different ballgame.
So here's the kicker. When you look at the sulforaphane extracts they use in supplements, the bioavailability is, wait for it, only about 10%. Just 10. So think about that. You pop a pill with 100 milligrams, and your body can only actually use maybe 10 of them. That's a massive, massive hurdle to overcome.
So what in the world is bioavailability? Let's keep it simple. Think of it like this. Your body is a locked treasure chest, and sulforaphane is the treasure inside. Bioavailability is basically how good your key is. If you have a great key, you get all the treasure. But if your key's kind of crummy, like with sulforaphane supplements, you're leaving most of that treasure locked away. And honestly, this one single problem is why the hype often gets way ahead of the science.
Okay, so we know there's this big absorption issue. So what does the evidence actually say? Where has it been shown to work? Well, despite that hurdle, there are some human studies that have turned up some pretty surprising and pretty significant results, especially in one particular area.
Yeah, if you really comb through all the research on humans, the strongest, most convincing evidence we have right now comes from studies on men with prostate cancer. Specifically, men whose cancer markers started to rise again after they'd had surgery.
And the results? Honestly, they were pretty incredible. In one of the main randomized trials, taking a 60 milligram sulforaphane supplement every day made a huge difference. It seriously slowed down what's called PSA doubling time. That's just a fancy way of saying how fast a key cancer marker is going up. So for the guys taking a placebo, that marker doubled in about 15.5 months. But for the guys on sulforaphane, it took almost 29 months. That's not a tiny little blip. That's a huge, clinically meaningful change.
And this chart just makes it crystal clear. Look at the bar for the sulforaphane group on the left, and then look at the placebo group on the right. You can see just how much slower that progression was. Now, this is exactly the kind of data that makes scientists sit up and pay attention. Of course, it still needs to be backed up in bigger studies, but wow, it's promising.
And it's not just prostate cancer. There's other interesting research out there too. For example, in lab studies with mice, they found sulforaphane can actually target and wipe out breast cancer stem cells, which stop the tumors from coming back. Now, we've got to be super clear. This is in mice, not people. But it's exactly this kind of work that gives scientists a good reason to start looking at this in human trials.
So what about just eating broccoli? Well, a huge review of studies in 2023 looked at exactly that. And what they found was a clear link. The more broccoli people ate, the lower their risk seemed to be for a bunch of different cancers, like lung, stomach, and colorectal cancer. Now, does this prove that broccoli causes the lower risk? No, it's a correlation. But it definitely strongly suggests there's a protective effect happening when you eat the whole food.
All right, let's switch gears a little bit for our fourth section. Because separate from any of its direct anti-cancer properties, sulforaphane has another superpower. It's a really potent anti-inflammatory. And that, as we'll see, is a huge deal for our overall health.
So to get this, we have to talk about something called C-reactive protein, or CRP for short. Basically, it's a marker in your blood. When your body is inflamed, your liver pumps out more of this stuff. So doctors can measure your CRP levels to get a pretty good snapshot of how much inflammation is going on inside you. So how well does it work? Check this out. One pilot study looked at HIV patients who often struggle with a lot of chronic inflammation. They gave them a daily sulforaphane supplement, and in just 12 weeks, it dropped their CRP levels by 40%. 40! The placebo group only saw a 12% drop. And we've seen similar kinds of results in studies with diabetic patients, too.
Why should you care about this? Because that constant low-level inflammation is like a secret engine driving so many different health issues, and we know it's tightly linked to cancer getting worse. So if you can lower that inflammation, you're making a real contribution to your overall health and just your quality of life. And that's a huge win all by itself.
Okay, all of this brings us to our final and maybe the most important takeaway of all. Where's the real power in all this? Let's put all these puzzle pieces together and see what the big picture looks like.
So here's the bottom line. The research on taking high-dose sulforaphane supplements, it's definitely promising, but only in these very specific situations. And that huge absorption problem we talked about, it really suggests we might be focusing on the wrong thing, kind of missing the forest for the trees. Maybe the real magic is in one little compound you put in a pill. Maybe it's in the whole food.
So let's do a quick recap. What did we learn? 1. Sulforaphane is a super cool compound, but our bodies are terrible at absorbing it from supplements. 2. The best evidence we have for it actually working is in that one specific prostate cancer study. 3. It's a legit, well-documented anti-inflammatory. And 4, and this is the big one, the clearest, most consistent benefit seems to come from just eating your veggies, a diet packed with broccoli and other cruciferous vegetables.
And that really leaves us with one final big question to think about. We're always looking for that one magic bullet, right? That one superfood that's going to solve everything. But what if we're looking in the wrong place? What if the real power isn't in one single compound, but in how all the nutrients in a whole food work together? And what if the real superfood isn't broccoli at all, but the entire grocery aisle?